Good morning, everyone. If you are watching us live, happy Saturday. And if you're watching the recording, well, I just hope you're having a great day, whatever day it is. I am Dorothy Knuckles with University of Maryland Extension. I am a financial educator as well as a health insurance educator. And we conduct financial education all throughout the state of Maryland. We have offices in every county in the city of Baltimore. So I'm really glad that you're here with me now. I am really appreciative of Cash Maryland for inviting me here this morning to speak to you. I also encourage you to stay for the other presenters. We have several going on this morning, and also visit the exhibitor booths. There's a lot of very good material, very helpful financial information for you. So I'm really glad to be with you here. I'm going to be speaking to you now about managing health insurance and resolving conflicts. No one loves financial conflicts. It can be very stressful. So what our hope is that we'll be able to provide you with some information that will help you know the steps to resolve conflicts, and also so the confidence to know that you've got this, you can do this. The health insurance industry provides you with some tools, but what we have found is that through our studies that more than half of the people that we interviewed have had some type of dispute or conflict with their health insurance provider, and very few expressed confidence that they knew what to do if that came up. So hopefully we'll leave you with just a better understanding of how to walk through that process if it should occur to you. So before we start, what I'm hoping that you'll do is to help me out. We are hoping that this is helpful information for you, but I don't know that unless I hear back from you. On the screen right now is a brief survey. I'm going to put the link to this in our chat box. But if you are watching this on a laptop, or you have your phone with you, you're not using your phone, you can also access this, this brief questionnaire. There's just a couple questions by using the QR code that is on your screen. We're going to ask a few questions now, ask the same few at the end, and just see if this material was helpful for you. The responses are completely anonymous, but they do help us out, and they help us to sometimes go back to the drawing board, or we look at our programs to make sure that they're giving you the information that you need. So I'll give you a moment to access that, and then I will proceed. Throughout the program today, we'll be asking for some feedback. I realize that it's recorded, but if it's Saturday morning, I am here on the other end, and if not, you still get to participate. We'll have a couple games for you as we go through. So we'll go ahead and get started. You may still be finishing this, but we will go ahead and work through our plan for the next half hour or so. So what we're going to do today is we are going to explore some strategies. We're going to help you know in advance some things that you can do to use and to manage your health insurance to protect both your health and your finance. So health insurance is to protect your health, to keep you healthy, to be able to use your benefits to get healthy and to stay healthy. But it's also financially protective. When you have health insurance, it protects your savings so that you know that your health needs are paid for. We'll also talk about how to resolve health insurance conflicts if they come up, as well as taking the steps to avoid them in the future. Save everyone a little bit of time, helped you to avoid them in the future. So to do that, we're going to answer three main questions, and they're in this order on purpose. First, we're going to talk about the why. Why do health insurance conflicts happen to begin with? They happen when you have certain expectations, and those expectations aren't met. And we'll talk about why that happens. Then we'll talk about what steps should I take to resolve health insurance conflicts or billing conflicts if they happen. They do happen. What can you do to prevent them? And that's lastly the how. How can you manage your health insurance to avoid conflicts in the future? So as I mentioned, the very first question we'll address is the why. Why do health insurance conflicts happen to begin with? We know that they happen. What situations though cause them? And they really happen for two major reasons, two major categories. One is due to coverage issues. So health insurance coverage refers to the treatments, the items that your health insurance company has agreed, contracted with you to cover for you. And sometimes there are issues that come up regarding coverage. You may expect something to be covered by insurance and it's not. The other major category for potential conflicts is charges. Maybe there's a procedure, a visit that was covered by your health insurance company, but when you get the bill, you're surprised by the cost. You weren't expecting the charges to be what they were, so that can potentially cause a conflict as well. And you'll notice as we talk about them, we'll cover several reasons for both coverage and charges conflicts, and they will overlap a little bit. So if you think of these as two rings, there's some overlapping reasons why they happen. The first thing we're going to address is, we'll talk about coverage issues. As I mentioned, coverage refers to the services that your health insurance company has agreed to pay for. You have a contract between you and your health insurance company. We'll talk about that contract coming up, but there could potentially be some issues regarding coverage when you expect your company to pay for certain medical, surgical, or perhaps vision or dental care. We're going to primarily focus on health insurance, but depending on how you have your insurance, whether you're on Medicare, whether you're on traditional insurance, some of these might be separate policies, some of them might be combined, but all of the items are relevant regardless of what type of insurance we're talking about. So let's talk about some coverage issues, because not everything is going to be covered by your health insurance policy. You might want to seek a service and find out that it's not covered. So it's important to know ahead of time what some of those coverage issues are. So when you want a procedure, some type of health coverage, there's a potential for that claim to be denied. But why are they denied? And there's several reasons. One is it could be because of the type of treatment that you want to have. And even under that, there are several reasons why the treatment is not covered. If what you want is not offered in your insurance plan, it is very likely that your insurance company will not cover it. If it's not in your contract, it could be denied. Your claim for coverage could potentially denied. Another reason, if you are seeking something that is considered experimental or outside of the standard of care. So what does that mean? Something is experimental if it has not yet been fully tested and deemed safe. It might not be covered by your insurance company. It could be provided through other means, and your healthcare provider can talk to you about that. But it might not be covered under your health insurance policy. Or something could be considered safe, but it's outside the standard of care for what you want it for. It means it's tested, but it may be tested for something else other than what you have. Healthcare is complex, our bodies are complex, so something might be standard for one person and not standard for somebody else. It could be considered not medically necessary by your health insurance provider. And this category can be a little complicated too. I'll give you an example. If you suffer from, let's just say, chronic headaches, your health insurance provider may consider it necessary for you to have nasal surgery to get relief from that. But if you want nasal surgery because you don't like the way your nose looks, it may be considered not medically necessary by your health insurance company. So that can really vary a lot from person to person. And you may hear that health insurance covered a procedure for one person and you may be denied. So it's important to connect with your health insurance company to make sure that it's covered. A big reason why some claims are denied is if you sought treatment that was outside of your network. Your network of providers are the providers that have agreed to provide coverage. They have an agreement with your health insurance provider, with your health insurance company to provide services for you. But if you seek care by a provider that is outside of that network, it is possible that the claims will be denied. I'm going to bring up that term a lot throughout this, this program, because this can be, out of network can cause problems with costs. It can cause several issues. So it is important to make sure that the care that you receive is in network whenever possible. There are some exceptions for emergency needs, but it is possible, depending on your health insurance company and how your health insurance is set up, what your agreement states, that a claim could be denied if your provider, if your health provider was out of the network. So there's some other reasons other than the type of treatment why claims could be denied. And sometimes those reasons are because of us, because of the patients or the consumers. It could be intentional, it could be a mistake, and it can be very easily resolved. But sometimes the reasons do come down to actions on the part of us, the patients. So one is if care is received without having insurance. Now that might seem obvious on its face, but it happens, and it can happen for several reasons. It could happen if you receive care before the effective start date of your policy. It could also happen if you receive care after a lapse in policy. Just about every health insurance policy has a grace period if payments aren't made. But if you receive care and don't make your payments, it's possible that your health insurance could lapse and the care not be covered. So do be very careful to make your monthly health insurance payments. Or if you change jobs, if you have a gap in insurance between employers, if you have employer provided health insurance, that's also another potential reason why you receive care without insurance. So under those circumstances, do be careful that you have your coverage in place before receiving care. So another reason that can fall back on the patient is if we provide incorrect information. And I'm not necessarily talking at this point about intentional. Sometimes it happens accidentally, or maybe just our handwriting on a form is misread. But if we provide incorrect information, incorrect phone number, incorrect address, incorrect personal information, or leave the junior off of our name and for your junior or senior, that can cause a claim to be denied initially. Usually that's very easily fixed, but it could lead to, at least initially, a claim being denied because there's a mismatch in information. Another reason now is if you give false information to your health insurance provider or your health provider. So it is important on all forms, on all applications, to be honest, to give correct information to information. Giving false information intentionally can lead to health insurance fraud and claims to be denied. Another couple reasons. Sometimes the reason why a claim is denied goes back to your health provider. And the two reasons are on the screen in front of you due to some type of error. These also are usually easily solved, but initial claim could be denied because of a coding error. Every single procedure has a code. There are tens of thousands of them. And if something becomes miscoded by your provider, there could be a miscommunication, misinformation, and a claim could be denied, and also due to a clerical error. All right, so I have just presented you with a lot of reasons why a health insurance claim could be denied. So now we're going to take a moment and do a little review in the form of a game. And what more appropriate game could there be than Family Feud? So here's how this is going to work. I'm going to put a question on the screen for you, and I'm going to make sure the sound is coming out of my computer so you get to hear the sound as well, because that's where the fun is. And then I'll give you about a minute or so to come up with as many reasons as many answers as you can think of for this. Put them in the chat box or write them down, and then I will reveal the answers to you. So here we go. So the question is, What are the reasons a health insurance claim might be denied? Ready, go. Put those answers in the chat box if you're live, or just write them down. Just pausing for a moment. All right, so let's take a look at those reasons, see how many you got. Now, we don't have a survey. Each of these is just 1 point. So here we go. The reasons why it could be denied. You sought care out of network. The treatment was not part of your plan. It was considered not medically necessary. 4, experimental treatment. 5, you are no longer in your health insurance plan. 6, there could be a clerical error. This is not a comprehensive list, but hopefully you got a bunch of those. And we will continue on. To get to the right button here for the game. There we go. So we've covered one broad category of why health insurance conflicts happen, and that is because of a coverage issue. A claim was denied. Another broad category of why health insurance conflicts occur is charges. You get the bill and you go, whoa, I did not expect for the bill to be this high. I don't think many conflicts happen if you get a bill and you go, oh, this is lower than what I expected. You're probably not going to call your insurance company and try to figure out why, because that's a happy surprise. But sometimes there are unhappy surprises when the charges are more than what you expect. So let's talk about some of those reasons, and later we'll talk about how to avoid them. So why do unexpected charges happen on my healthcare bill? Main reason, and you may have heard this term, is balance billing. And now we're going to go back to that out-of-network care that's going to be coming up a lot. So if you see a health provider that is not part of your health insurance network, it's not a provider that's contracted by your insurance company, the provider can charge you the full amount of the bill. I'll give you an example. Suppose you have a checkup, you're not feeling well, you go see a healthcare provider, you go see a doctor, and the bill is $100. Well, if an in-network doctor would be $70, if your insurance company has agreed with a provider that that care would cost $70 with that provider, then the insurance company might cover that $70, but you could still be responsible for that extra $30 if that provider is out of network, and that is called balance billing. Another reason why there are unexpected charges could be that you haven't yet met your deductible or out-of-pocket maximum. If you lose track of your deductible, especially once that plan year has turned over, which is usually January, but sometimes it could be during another time in the year, when it's a new plan year, you start your deductible all over again. We'll talk more about deductibles toward the end when we talk about how to avoid issues with your health insurance company, but this is one major reason why there could be a dispute with your health insurance company. You haven't yet met your deductible and didn't quite realize it. Another surprisingly common reason why there are unexpected charges on a healthcare bill is due to medical identity theft or fraud. And that is when someone finds or learns your identity and uses your identity to receive healthcare. Then you receive the bill and it's not yours. And one reason why it's very important to pay close attention to your records. Again, these are fixable, but these are common reasons why there are unexpected charges on healthcare bills that could lead to conflicts with your health insurance company. So let's talk about a couple others. Errors, again, on anyone's part, your part, the health provider's part, the health insurance company, can all lead to unexpected costs on the bill. For medical coding, the clerical errors, occasionally there can be duplicate or extra charges, or mistaken identity. All of these are similar to some of the reasons why there were coverage issues. If there's someone with a name similar to yours that received care and you received the bill, that happens. And these all go back to the importance of reviewing carefully bills that you receive or any correspondence that you receive from your health insurance provider and from your health insurance company. So don't take that envelope and put it aside. Take a good look at it and make sure everything is accurate and yours. So hope you're ready for another round of Family Feud. We're going to cover some of the reasons why unexpected costs are on your bill. Now, let me get to the right tab here. The question is, what are the reasons for unexpected costs on healthcare bills? Ready, go. Put those answers in the chat box or write them down. Give you a couple moments for that. All right, got some of those answers in mind. Let's go and reveal those. We're going to hide the question. And the responses are to why there are unexpected charges, maybe out of network, or deductible has not yet been met, and you're responsible for the charges. There could be a coding error, perhaps mistaken identity, duplicate or extra charges, and lack of identity fraud. So do be careful of all of those. So we've answered quite a long list of why. Why do these health insurance conflicts happen? What are the causes of coverage and billing problems? So now we'll talk about what. Now that you know why, what steps can I take to resolve health insurance billing conflicts? And there are many steps laid out for you, often by your health insurance provider themselves, because they want you to be able to handle these conflicts. You do have some tools, and we'll talk about what they are. So what do you do first? What are the very first steps? And you have really one of two options. You can contact your healthcare provider. And as I mentioned, this can be dental, it can be vision, it can be perhaps prescription. Usually it's your healthcare provider. Or you can also contact your health insurance provider. In our research, putting this program together, I interviewed many healthcare providers, and they all expressed willingness. They're all glad to help resolve health insurance conflicts. They usually have good information on what to do next. So they were all very willing to take that phone call and help you work out any issues that you may have with health insurance coverage for the care that they provided for you. So if you contact your health insurance provider, though, how do you do that? Hopefully you carry your health insurance card with you. It's one of our smart actions for using your health insurance. Carrying that card with you, and on your health insurance card are contact phone numbers, customer service phone numbers, information for you to call if that's how you'd like to handle that. There's also information on the website, so there are several ways that you can find out information about how to contact your health insurance company. So there are other ways also, though. As I mentioned, your health insurance provider tells you how to, tells you what's covered and how to manage disputes with them. It's not hidden, but it can be a little hard to find. And you find that through their evidence of coverage. The evidence of coverage, what is that? At the beginning of each plan year, you very well might receive a large envelope from your health insurance provider. Hopefully you open it, you take it out, and you see this booklet and look through it. A lot of us will put it aside. We'll say we'll read it later because it's usually quite lengthy. Mine, I believe, is over 100 pages long. But in that evidence of coverage, which is your contract, that is your contract with your health insurance company, there's information on what to do if you do have a conflict with them, what steps that you can take. And it is laid out, and most of them are very well organized. Most of the time you have a hard copy of your evidence of coverage, but it's also typically available through your provider, through their online portal. So there are several ways of accessing your evidence of coverage, but your evidence of coverage is everything you need to know about your health insurance plan, what is covered, what's not, what your deductibles are, information about knowing what providers are in your network, and so on. So that's all in your evidence of coverage. But what happens if you need to appeal a health insurance decision? That does happen, and there is a set procedure laid out for you. So you do have recourse. There are steps that you can take. I'm going to put them all up here, and then we'll talk through this. So what happens if you appeal a health insurance decision? The first thing that happens when you want some type of care is you submit your claim, and what happens if that claim is denied? Now you'll see the steps on the screen. Let's look at the top bar, which says file a health insurance claim, and you'll see with most of these, there are a few different sets of numbers. If you file a claim with your health insurance company before you receive care, they have to notify you within 15 days if you're covered or not. If you put the claim in after you receive care, they have longer. They have 30 days to explain if it's covered or not. And then the really short time frame, the 72 hours, is if it's an emergency or something that's very urgent. So if they approve your claim, you're good to go. But if it's denied, then you can go through an internal appeal process, and that's an appeal process with your health insurance company itself. They have an oversight division, and you can file an appeal directly with your insurance company. And again, the number of days varies depending on whether you have received care or not yet. You can also file an external review. So every state has an approved external insurance review procedure. It's outlined in healthcare.gov. I'll give you that website at the end, but it tells you what your external appeal process is. This is a oversight that is outside of the purview of the insurance company, and they will review your claim. So there is that external review as well. And the length of time they have to respond depends on whether you've had the care or not, and whether it's urgent. All right, round 3 is coming up. The question is, what are the steps in the health coverage claim process? These are what we just talked about. I know it's complicated. See how many you can remember. Give you a couple moments for that. All right, let's walk through those steps, and these I happen to have in order here. So step 1, file a claim. You can do this before or after receiving care, which we'll talk about shortly. Then the next step is actually not something that you do. It either gives you approval or denial. So you receive the approval or the denial of your claim. Then you can file an internal appeal. And if you're still not satisfied with the answer, you can file an external appeal. Now, I will say that if the care is urgent, you can file the internal and the external appeal at the same time, and then they have to respond within 72 hours. So you do have that safety net if something is urgent. So lastly, let's talk about our last question, and that is the how. Because what's the expression? An ounce of prevention is worth a pound of cure. Is that right? So how can I manage my health insurance to avoid conflicts in the future? This saves a lot of time, a lot of stress, a lot of energy on your part. So that's really what it's all about. How can you avoid the conflicts? It's not always They're not always totally unavoidable, but what can you do? Because conflict is stressful. So very first thing is to check your provider network before receiving care. In an emergency situation, if you need emergency care, if you have to go to the emergency room in an emergency, you are protected if the providers are out of network most of the time. But check your provider network whenever possible before receiving care. And this is especially true if your primary care provider sends you for lab tests or some other service where they may not know if those particular providers they're recommending are in your network or not. So this is where you need to advocate for yourself and make sure that all of the providers that you are seeing or that are part of your healthcare service are in your network. Another is to get an upfront estimate of the costs so that you know in advance what something is going to cost you. This may not be a perfect estimate. In healthcare, our health is complex. And sometimes a healthcare provider will find something or something is just more complex than expected, but you can get an estimate. You can know a little bit more upfront. Ask how much something might cost. Sometimes we forget that we can ask our providers what something is going to cost us so that we know and we can be prepared. Another step is to review the evidence of coverage to know what is and not covered. So that's all in the evidence of coverage. We talked about that booklet or on the website. Know before you go. And then check pre-approval requirements. Some plans require pre-approval from a primary care provider before you actually receive other types of specialized health care. So do check your requirements. That can vary tremendously by the type of insurance you have and your health insurance company, so do check for that. Continuing on, what other steps can you take? And one is to file a claim before receiving care. We talked about the steps to filing a claim just a few minutes ago. Let me walk through that process briefly. But do know that you can file that claim before you receive care. And when you file it first, you have, first of all, your insurance company has to respond a little bit faster. And then you know in advance and you can go through the appeals process before receiving the care. So file the claim with your insurance company, receive the approval or denial. These are the steps again. Then you have the opportunity to file an internal appeal first and the external review. So you can do that before receiving care. Another step is to be careful of the costs. We talked about how sometimes a bill is higher than expected because we haven't met our deductible yet. But what does that mean? So the deductible is what you need to pay each year, typically, for your health care before your health insurance plan pays anything. Now, there's some procedures, there's some care where it's outside of the deductible. It's just covered for you. So preventative care is often paid without needing to go into your deductible. It's often just provided so that you stay healthy. Your well patient visits, immunizations might be covered outright, not having to worry about a deductible. But everything else, usually you need to meet a deductible before the health insurance company pays anything. Then there's a period of time before you reach your yearly maximum where you pay a portion and your health insurance company pays a portion. And that's called your co-payments. So you pay part and they pay part, but you still need to be prepared to pay something for your care. And then know when you reach your out-of-pocket maximum, because then typically everything that you receive care for is covered entirely by your health insurance provider. But knowing those amounts will be very helpful for you so that you can plan and budget and set aside savings. So be prepared to pay out-of-pocket costs. All right, we are going into our final round. Question is, what are the ways to protect my finances from unexpected healthcare costs? What can you do to avoid health insurance conflicts? I'll give you a few minutes to share your answers for that, and then we'll reveal. All right, let's take a look at those responses. What can you do to avoid health insurance conflicts? What steps can you take? And they are your provider network, get in network service. Check before you go. Get an estimate of the cost. Avoid those surprises if possible. Excuse me. File a claim before receiving care. Not necessarily something you need to do for a well patient visit or if you have something simple, but for anything complex, file a claim before care if possible. Budget for out-of-pocket costs. Know what your deductible is, how much you will need to pay out of your pocket before the insurance company pays, and prepare for that by making that part of your spending and savings plan. So budget for out-of-pocket costs, and related to that, check pre-approval requirements. So sometimes some policies will require you to get pre-approval before receiving care. All right, we're going to do a little review and wrap up. So here are some insurance management and dispute resolution strategies. The first group is to prevent them to begin with. And they are keep all of your health insurance papers organized. When you know where to go to check your records, when you have things relatively well organized, it takes the stress out of looking back and just making sure everything is accurate. So keep your health insurance papers organized in a way that works for you. Different people like different types of organizational systems, spreadsheets, apps, shoebox, but do something that works. 2 is to budget for your deductible and out-of-pocket maximums. Being prepared in advance, having a plan for your money that includes a category for health and health insurance is important for staying healthy. And your health and your finances are very much intertwined. 3 is to track your health expenses. So as the bills come, as the documentation from health providers comes in, it can be complicated. So track them and have your evidence of coverage, that booklet or that website bookmarked so you can find it. That way you know where to look if you have any questions or concerns about what's going on with your health insurance. So some dispute management strategies, and these are particular, they can be particular for your health insurance dispute resolution, but they can also apply to other areas in your life if you have a dispute for just about anything. And one is to document all communication. So if you talk with someone on the phone or through a website, write down, you have a little notebook to keep with your insurance papers on who you talked to, what the date was, and what the resolution was, if any, and how you can reach them again. Second, which can be very helpful in so many conflict avoidance plans, is to, before handling the conflict, before talking with someone, write down what you want to say. It can be easy to get flustered, especially in stressful situations. So write down first what you want to say, what you want to get out of the conversation, and then remain calm as you're talking to the individual at the other end. And 3, to ask your healthcare provider for assistance with health insurance disputes. As I mentioned earlier, most providers are very willing to help you resolve problems with health insurance. It's really all 3 parties working together, you, your health provider, and your health insurance provider. So let's talk about some reliable resources if you want to get additional information or help with health insurance information. The last screen I'll give you has my contact information, so I'm happy to send this out to anyone who asks. If you want to email me and say, can you send me this list so I can just click on the resource, I will be happy to do that. And I'll give you that email address. But the first site is University of Maryland Extension has a health insurance information page. So you can contact us there at www.extension.umd.edu and then insure. Healthcare.gov has a lot of good information to help you understand how to work through health insurance conflicts. There's Consumers Union and the Centers for Medicare and Medicaid Services. And as I mentioned, I'll be happy to send you all this information with clickable links on it. So I am going to be here until noon for direct questions. You're also free to email me. Before you go though, I'm hoping that you will do the post-program evaluation. For those of you who did the pre-program evaluation, hopefully you wrote down that 4-digit code that I asked you for in the beginning. This helps us to match the beginning and the end evaluation, so we know if this helped you. If you didn't do the, or you weren't here for the pre-program evaluation, it will ask you for a code, anything that you'd like, and then there's a few questions to fill out at the end. I'll put the link to this in the chat box. It should take you about 30 seconds to fill out, but it really does help me a lot, so I'd appreciate anyone, whether you're watching live or whether you're coming back to watch this later, doing this. You can access it through the QR code or through the link in the chat box. So here is my contact information. You are welcome to email me, dknuckles@umd.edu, and I will be hanging out in the chat box for any questions that may happen.